Healing after a traumatic birth is not a linear process. There's a lot of different steps and phases you might go through after having a traumatic childbirth experience. My name's Allison Lorne. I'm a certified nurse midwife, and I help people recover from difficult and traumatic childbirths. Click the link in my bio to visit my website and learn more about my offerings. I have a growing online community, and I also have clients that I carry out for one to one counseling and coaching appointments. Now, having gone through a difficult childbirth, you might just be feeling like you're in shell shock and then burdened with the care of a newborn and running a household. It can be overwhelming. It's unfortunate that we don't do enough in the hospital or even in birth centers or at home to really help people integrate the birth experience. Now, this is disproportionately a problem in the hospital setting where care is delivered quickly with multiple team members, and you might see your primary provider for certain touch points during the labor, for the delivery, and then a checkup before you get discharged home. Then usually it's a 6-week interval until your postpartum visit, which might just be a 15 or 20-minute checkup to see how your body's healing. And unfortunately, yeah, we just don't do enough to make sure that we're following up for the mental and spiritual well being of our clients. It's why I do the work that I do. So, if you've had a difficult birth, where do you start? Well, the first thing to know is that you're not alone and that about 20% of people report feeling mistreated in their maternity care. That aside, the number of people that report that they have had a traumatic experience during childbirth is even higher. Now, what needs to happen before we're working into healing trauma is one, just to identify that it was trauma. So, through the definition of trauma as being a complete lack of control of your circumstances and a fear for your well being or that of a loved one, including the newborn baby, it's really easy to see how trauma can occur in the childbirth setting. There's no time like childbirth. Like, people are the most vulnerable when they're giving birth. Physically, emotionally, there's just no comparison to how vulnerable somebody is when they're in that position. Now, we layer that on with fast paced clinical decisions that aren't fully explained or explained like slowly enough that you can really incorporate what's being said, and decisions that have to be made on a dime. There's a sense of pressure sometimes when it's an emergency situation to just move and get on with the plan of action, and you might not really be processing what it feels like emotionally, like how scary it really was to have to go down to the operating room and have an emergency C-section you weren't planning for. So it's very relatable that trauma occurs in this environment. And furthermore, what's really important is to witness and hold space for people's experience. So before we talk about trying to just get to healing trauma, we really have to witness and hold space for people to share as much as they're comfortable with sharing about that story. Now, trauma recovery work in modern day psychology does not encourage you outlining everything that happened A to Z and retelling the whole story in a way that would be re traumatizing. We want to avoid feelings of overwhelm and avoid the client feeling re traumatized in telling their story. So, as much as you're comfortable with unpacking your experience, remember trauma is a totally personalized experience. No one can tell you that you had trauma or you didn't have trauma or that you shouldn't have had trauma. I've seen normal vaginal deliveries that end up with a patient feeling really traumatized. And what's important is to honor where people are coming from in their process and in their story. If we liken this to a veteran coming back from war, we don't say, oh, it couldn't have been that bad, or at least you came back alive. It really requires some sensitivity and empathy to hold space for how difficult someone's experience may have been, even if it's totally foreign to your own. So when you're the one that's had trauma, don't fall into feeling ashamed of your trauma or trying to make other people comfortable by minimizing your trauma. Really finding the right support and community that honors your story as it is and isn't trying to talk you out of your experience, that's really important. It is what I do in facilitating groups on my program is to help people feel witnessed, heard, listened to, and held in their experience. No one's going to tell you it wasn't as bad as you made it out to be because that's irrelevant. What matters is where you are now. So, at the first step in trauma recovery, it's accepting where you are right now. It's putting a name to what happened and understanding that the word trauma isn't a bad word. So, being able to recognize and name that it was trauma is a huge first step in the healing journey itself. Then we want to be able to get into how we can help integrate that experience, how the trauma experience can become part of your story without triggering you and causing negative emotions. There's a lot of different modalities in trauma healing and trauma recovery, and it's about finding what works for you. Meanwhile, being in community with others that have had similar experiences can be really supportive. Um, so the work of healing your birth story is really deep, rich work. And this is where we're taking the story of your birth as you're telling it and listening for themes of victimization, disempowerment, loss of agency, fear, loss of control, where these negative themes come forward. And you can tell when you're listening to the words that you use and the tone of voice you're using, how you're characterizing your own opinion of your own role in your birth story. With a keen ear for listening and picking up this trauma language, we can start to identify where things went off the rails, what things were said or done that made you feel a certain way. Now, what we can work with is that feeling that you had. And what we can work with is the feeling that you're having now in the moment, in the present moment, when you're thinking about your birth. The work that I do, I'm really helping people come along into finding and capitalizing on points in their story that were actually really exhibiting their resilience and their strength and their fortitude and their heroism. So, uh, focusing, shifting our focus on what went right, what you did right in the birth is a huge shift in perspective, a huge paradigm shift for your own mentality to be able to view yourself and your birth story as the hero. So, when we're shifting away from what happened around us to what happens inside and the internal landscape, we really are able to claim our power. And the subconscious responds to repetition. So, every time you're telling that birth story in a way that paints yourself as a victim, you're believing it deeper each time. And if you notice and scan your body when you're telling your birth story, you might feel anxiety, sweaty palms, increased heart rate, shallow breathing, even nauseous or feeling discombobulated and even faint. Those are all signs that your body is responding in the present moment to a memory that's being brought forward by your storytelling. The subconscious doesn't realize that it's not in the present moment. The subconscious thinks it's happening all over again. And in that way, you're increasing the strength of the neural connections that are equating your birth story to your trauma. So it's not to, this work doesn't bypass what happened. And that first step, like I said, is so important to witness and hold space for where people are at and just naming that trauma occurred. But when you're ready to shift your perspective and focus on what things went well and where your strength and heroism is, we can look and identify for even the smallest pieces that you got to the hospital on time, that you had adequate support within your own support network, for example, that you felt an immediate sense of protection towards the baby. That's a natural maternal instinct, and it's something to celebrate. Bonding doesn't come easy to everybody. So, really finding what it is that you did well and capitalizing and celebrating that is what's going to bring your spirit forward. It's what's going to create the uplift that you need to get through trauma recovery and a difficult postpartum period. My work is really designed for people that are ready to take these steps to shift and move forward and change and step out of an old story. You can make a new story, and your subconscious will respond to your story. It's important to tell your new story again and again and again so that your subconscious gets that benefit of repetition. This is the work that I provide, and I have a whole workbook and 5-step process and how we go about rewriting your birth story. If it's something that resonates with you, please follow the link in my bio and fill out an application on my website if you'd like to work with me individually or in the groups that I offer. I'm Allison Lorne, certified nurse midwife, and this is Holistic Birth Recovery.